Lupus is an autoimmune disease that occurs when your body's immune system attacks your own tissues and organs. Inflammation caused by lupus can affect different body systems, including joints, skin, kidneys, brain, blood cells, heart, and lungs. Symptoms usually start in early adulthood, anywhere from the teen years into the 30s. According to the Lupus Foundation of America, it is estimated that 1.5 million Americans and at least 5 million people worldwide have some form of lupus. This video will discuss 10 early signs and symptoms of lupus disease, so be attentive. Number 1. Skin rash or lesions. One of the most visible lupus symptoms is a butterfly-shaped rash that appears over the bridge of the nose and on both cheeks. It is estimated that around 50% of people with lupus have this rash. It usually appears after exposure to sunlight. Sometimes the rash appears just before a flare-up. Lupus can also cause non-itchy lesions in other body parts. Most people with lupus are sensitive to the sun or even to artificial lighting. Number 2. Pulmonary issues. Another possible symptoms of lupus is the inflammation of the pulmonary system. The lungs become inflamed and the swelling can even extend to lung blood vessels. These conditions can lead to chest pain when you try to breathe in. Over time, breathing issues from lupus can shrink lung size, which is called vanishing or shrinking lung syndrome. Number 3. Kidney inflammation. Lupus can also cause a kidney inflammation called nephritis. Inflammations make it difficult for the kidney to filter toxins and waste from the blood. Nephritis usually begins within 5 years of the start of lupus. Early symptoms of nephritis include swelling in the lower legs and feet, high blood pressure, blood in urine, darker urine, and frequent urination. Number 4. Joint swelling. Inflammation can cause pain, swelling, and stiffness in joints, particularly in the morning. It can be mild at first and gradually become more obvious. Just like other symptoms of lupus, joint problems can also come and go. Number 5. Fatigue. About 90% of people with lupus experience fatigue. An afternoon nap can help you get rid of fatigue, but sleeping too much during the day can lead to insomnia at night. It is difficult, but if you stick to a daily routine and remain active, you may be able to keep your energy levels up. Number 6. Unexplained fever. One of the early symptoms of lupus is a low-grade fever between 98.5 to 101 Fahrenheit. People with lupus experience this type of fever off and on. A low-grade fever may be a symptom of inflammation, infection, or imminent flare-up. Number 7. Hair loss. One of the first symptoms of lupus is thinning of hair. Due to the inflammation of the skin and scalp, hair loss occurs. Some people with lupus lose hair by the clumps. Some people also experience thinning of their beards, eyebrows, eyelashes, and other body hair. Lupus can make the hair feel brittle, break easily, and look a bit ragged, earning it the name lupus hair. Number 8. Dry mouth and eyes. You may experience dry mouth if you have lupus. Your eyes may feel gritty and dry too. Some people with lupus develop another autoimmune disorder called Sjogren's disease. Sjogren's disease causes the glands responsible for tears and saliva to malfunction, and lymphocytes can accumulate in the glands. Women with lupus and Sjogren's may also experience dryness of the vagina and skin. Number 9. Gastrointestinal problems. Some people with lupus experience occasional acid reflux, heartburn, or other GIT problems. Mild symptoms of acid reflux can be treated with over-the-counter antacids. If you have frequent bouts of heartburn or acid reflux, try cutting down on the size of your meals and avoid beverages containing caffeine. Number 10. Thyroid problems. It is common for people with lupus to develop autoimmune thyroid disease. Thyroid glands control the body's metabolism, and a poorly functioning thyroid can affect vital organs like the brain, heart, kidney, and liver. Other symptoms include dry skin, hair, and moodiness. Causes of lupus. People with an inherited predisposition for lupus develop the disease when they come into contact with something in the environment that can trigger lupus. Some potential triggers include medication. Lupus can be triggered by certain type of blood pressure medications, anti-seizure medications, and antibiotics. Sunlight. Exposure to the sun may bring on lupus skin lesions. Infection. Infection can initiate or even cause a relapse in some people. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell notification button to view more upcoming Create Cure content like this.